Feeling fine is not the same as being protected. I've met many people who are careful with what they eat, who rarely add salt to their meals, and who still watch their blood pressure slowly rise over time. That disconnect matters more after 55, when the body becomes less forgiving. I'm Dr. Warren Hung. On this channel, I focus on helping you understand what the body is actually doing underneath everyday habits, so you can avoid problems before they become harder to manage. If you want clear, practical medical explanations like this, consider subscribing. It helps you keep learning how to protect your health over time. There is one misunderstanding I want to correct early. Blood pressure is not controlled only by the salt you sprinkle on your food. In fact, for many people, especially older adults, most of the pressure load comes from foods that do not taste very salty at all. And this is where things become important. Your blood pressure is influenced by how your body handles fluid, how your blood vessels respond to stress, and how your kidneys regulate sodium and water balance. When you are younger, the system has more flexibility. The vessels expand more easily. The kidneys adjust more efficiently. Small mistakes are often absorbed without obvious consequences. But as the years pass, that reserve becomes smaller. Blood vessels stiffen. That means they do not relax as easily when pressure rises. The kidneys become less efficient at clearing excess sodium. Hormonal systems that regulate fluid balance become more sensitive and sometimes overreact. What used to be a minor dietary issue can now push pressure higher for longer periods of time. And the difficult part is that you usually do not feel this happening. High blood pressure often develops quietly. There is no warning pain, no immediate signal. Many people assume that if they do not feel unwell, everything must be under control. That is a form of false reassurance I see very often in clinic. What is actually happening underneath can be very different. When certain foods repeatedly introduce excess sodium or trigger fluid retention, your body holds onto more water. That increases the volume of blood moving through your vessels. At the same time, if those vessels are less flexible, the pressure inside them rises more than it used to. Over time, this constant pressure begins to affect the delicate lining of the blood vessels. That lining, called the endothelium, helps regulate how vessels expand and contract. When it becomes damaged, the vessels respond less effectively. Pressure control becomes more difficult. This is one of the early steps toward long-term vascular problems. And this is why the stakes are real. Persistently elevated blood pressure increases the risk of stroke by putting stress on the vessels in the brain. It increases the workload on the heart, which can lead to thickening of the heart muscle and eventually heart failure. It places strain on the kidneys, which depend on stable pressure to filter blood properly. None of this happens overnight. That is why it is often missed. Many people focus on obvious sources of salt and believe they are doing the right thing. They avoid adding salt at the table. They choose foods that do not taste salty. They feel reassured by that effort. But the hidden sources remain, quietly influencing blood pressure every day. So the question is not just, are you eating less salt? The more important question is, where is your body actually getting its sodium and pressure load from? Because once you see that clearly, you can change it. In the next part, I'm going to walk you through the first two foods that commonly raise blood pressure without people realizing it, and why they have a much stronger effect after 60. But the first one often looks harmless, and that's exactly why it causes so many problems. The first food often surprises people because it does not match what they expect. 1. Processed deli meats. This includes foods like ham, turkey slices, sausages, and packaged sandwich meats. Many people choose these because they seem practical, portion-controlled, and even lighter than red meat. Some labels say low fat. Some say high protein. That creates a sense of safety. But the issue here is not fat. It is sodium. Processed meats are preserved using salt and sodium-based compounds. This is not just for flavor. It is for shelf life, texture, and food safety. As a result, even a small portion can contain a large amount of sodium, sometimes more than half of what your body should handle in an entire day. And it does not taste overwhelmingly salty. That is the trap. When you eat these foods regularly, your body absorbs that sodium into the bloodstream. Sodium pulls water with it. So the more sodium you take in, the more fluid your body retains. That increases the volume of blood inside your vessels. If your blood vessels are already less flexible, which is common after 60, that added volume pushes pressure higher than it would in a younger system. I remember a patient in his early 70s who told me he had fixed his diet. He had stopped adding salt completely. But when we looked closely, he was eating deli turkey almost every day for lunch. His blood pressure stayed elevated despite his effort. And this illustrates something important about how the body works. The source of sodium matters more than whether you add salt at the table. Over time, this pattern does more than raise numbers on a blood pressure reading. It increases stress on the vessel walls, contributes to gradual stiffening, and raises the long-term risk of stroke and heart strain. A more protective approach is to shift toward fresh, unprocessed protein when possible. Even small changes, like replacing deli meat a few times a week, can reduce the constant sodium load your body is dealing with. Now, the second food is even more misleading, because many people actively choose it thinking it is a healthier option. 2. Canned soups. Canned soups often feel like a safe choice. They are warm, convenient, and frequently marketed as wholesome or balanced. Some are labeled as vegetable-based or low-fat, which adds to the impression that they support heart health. But most canned soups are built around one key ingredient: sodium. Salt is used to preserve the product and to maintain flavor after processing. Even varieties that do not taste strongly salty can contain very high sodium levels. A single bowl can deliver a large portion of your daily intake without you realizing it. And there is another layer to this. Soup is a liquid-based food. That means it not only contains sodium, but also contributes directly to fluid intake at the same time. For someone whose body already tends to retain fluid more easily, this combination can amplify the effect on blood pressure. The kidneys play a central role here. Their job is to filter blood and regulate sodium and fluid balance. With age, this system becomes less efficient. Sodium stays in circulation longer, fluid follows it. Pressure remains elevated for longer periods instead of returning to baseline quickly. That is why something that feels light and harmless can have a disproportionate effect. People often tell me they switch to soup because it feels easier to digest or more suitable later in life. That instinct makes sense. But the hidden sodium changes the outcome. A more controlled option is to prepare soup at home, where the salt level can be adjusted, or to choose carefully labeled low-sodium versions and still treat them as occasional, not daily, foods. What matters here is not avoiding these foods completely in every situation. It is understanding how often they appear in your routine and how they quietly add to your total pressure load. And once you see how hidden sodium builds up across the day, the next food becomes even more concerning, because it is something many people consume without even thinking about it. The next one is rarely seen as a blood pressure problem, because it doesn't taste like salt at all. 3. Bread and baked products. This includes sliced bread, rolls, crackers, and many packaged baked goods. Most people associate these foods with carbohydrates, not sodium. They don't feel like a salty choice. And that's exactly why they are overlooked. But bread is one of the largest sources of daily sodium in many diets. Not because each slice is extremely high on its own, but because it is eaten so often. Breakfast toast, sandwich at lunch, crackers as a snack, it adds up quietly across the day. And unlike something obviously salty, your brain does not register it as a risk. From a physiological standpoint, the effect is the same as any other sodium source. Sodium enters the bloodstream, draws water into circulation, and increases the volume your blood vessels must handle. If those vessels are less elastic, the pressure rises more sharply. But bread has an additional effect that becomes more relevant with age. Refined breads and many baked products break down quickly into glucose, which is sugar in the blood. When glucose rises quickly, the body releases insulin to bring it down. Over time, especially in people with insulin resistance or early metabolic changes, this pattern can contribute to vascular stiffness. That means your blood vessels not only handle more fluid, but also become less responsive to signals that help them relax. So now you have two pressures happening at once. More volume from sodium, less flexibility from metabolic stress. That combination matters. I often hear people say, "I don't eat salty foods, mostly just bread and simple meals." That feels reasonable. It feels controlled. But it misses how much of the daily sodium load is coming from those simple choices. And there is another layer of false reassurance here. Because bread is common, familiar, and part of daily routines, it does not feel like something that needs to be limited. It feels normal. And when something feels normal, it rarely gets questioned. But for someone over 60, whose vessels are already under more strain, that normal pattern can slowly push blood pressure higher without any obvious signal. This is where many people get caught, not because they are careless, but because the risk does not look like a risk. Reducing this effect does not mean eliminating bread completely. It means becoming more selective, paying attention to frequency, looking at sodium content per serving, and in some cases, reducing portion size or substituting with lower sodium options. Even small adjustments here can lower the constant background pressure your body is managing every day. Because what matters most is not one meal, it is the pattern your body experiences repeatedly. Yet even when people begin to notice hidden sodium in foods like bread, the next two items often remain in the routine and they can push blood pressure even higher over time. By this point, a pattern starts to appear. The problem is not only what tastes salty, it is what your body repeatedly absorbs without you noticing. The next two foods build on that pattern, but in slightly different ways. 4. Fast food and restaurant meals. This is not just about obvious items like fries or processed meats. It includes many meals that appear balanced salads with dressing, grilled dishes, even soups and sides. The issue is control. When food is prepared outside your home, you do not control how much sodium is used. Restaurants often rely on salt to enhance flavor, preserve consistency, and make food more appealing. Even meals that look moderate can contain very high sodium levels. And portions tend to be larger. So what happens is not just a small increase. It is often a sudden, significant sodium load entering your system at once. Your body responds by holding onto fluid. Blood volume increases, pressure rises. In a younger system, that spike may settle more quickly. But after 60, the recovery is slower. Blood vessels remain under stress for longer periods. That repeated stress contributes to gradual vessel damage. There is also a behavioral pattern here. Restaurant meals are often seen as occasional, but for many people, they become regular, once, twice, sometimes several times a week. Each time, the body experiences another high sodium exposure. Over weeks and months, that pattern becomes part of the baseline. This is why someone can feel like they eat fairly well most of the time and still struggle with blood pressure control. A more protective approach is not necessarily avoiding restaurants entirely, but being more intentional. Choosing simpler preparations, limiting sauces and dressings, and spacing these meals rather than stacking them across the week can make a meaningful difference. Now, the final food is different. It is not always about sodium alone. 5. Sugary drinks and sweetened beverages. This includes sodas, sweetened teas, energy drinks, and even some fruit-based drinks that seem healthy. The connection to blood pressure is less obvious, but it is clinically important. These drinks affect the body through metabolic pathways. When you consume a high amount of liquid sugar, blood glucose rises quickly. The body releases insulin to manage it. Over time, repeated spikes can contribute to insulin resistance, where the body becomes less responsive to insulin. And insulin resistance has a direct relationship with blood pressure. It affects how blood vessels respond. It influences how the kidneys handle sodium. It can increase fluid retention and make pressure regulation less stable. So even without high sodium, these drinks can indirectly raise blood pressure by disrupting the systems that normally keep it controlled. There is another factor to consider. Sugary drinks are easy to consume in large amounts. They do not create the same sense of fullness as solid food. That means it is possible to take in a significant metabolic load without feeling like you have eaten much at all. For older adults, especially those already dealing with changes in metabolism, this can quietly push multiple systems in the wrong direction at once. And again, there is a form of false reassurance. People often focus on salt and overlook sugar when thinking about blood pressure. They may reduce sodium in meals but continue drinking sweetened beverages daily. The pressure remains elevated, and the reason is not immediately obvious. Reducing or replacing these drinks with water or unsweetened options can remove a consistent source of metabolic stress. When you step back and look at all 5 foods together, a clearer picture emerges. It is not one single item causing the problem. It is the accumulation, small, repeated exposures that the body has to manage every day. And once you understand how these exposures add up, the next step is knowing how to turn that awareness into something practical you can use every day. Once you see where the pressure is coming from, the goal is not perfection. The goal is control you can actually maintain. Because what affects your blood pressure most is not a single meal. It is the pattern your body experiences every day. Let me bring the 5 foods together in a simple way. Processed meats add concentrated sodium in small portions. Canned soups combine sodium with fluid load. Bread and baked products add hidden sodium repeatedly across the day. Restaurant meals deliver large, unpredictable sodium spikes. Sugary drinks interfere with how your body regulates pressure from the inside. Each one on its own may seem manageable. Together, they create a constant background strain on your blood vessels, your heart, and your kidneys. So instead of trying to remember 5 separate warnings, it helps to think in terms of a daily structure. Start with one question in the morning. Where will most of my sodium come from today? That question alone changes awareness. If breakfast includes bread, you already know part of your intake. If lunch includes a packaged meal or deli meat, the total begins to rise. If dinner is from a restaurant, the load may be higher than expected. You are not guessing anymore, you are tracking patterns. The next step is spacing and substitution. Try to avoid stacking high sodium foods in the same day. If one meal includes a processed item, keep the others simpler. Fresh foods, basic ingredients, and home-prepared meals give you more control over what your body is handling. Then consider fluid balance. If sodium intake is higher on a given day, your body will retain more fluid. Being aware of that can help you avoid adding additional stress, especially late in the day when the body has less time to rebalance before sleep. Now think about beverages. Replacing sugary drinks with water or unsweetened options removes a consistent metabolic pressure. This is often one of the easiest changes to make, and it has a meaningful impact over time. There is also a practical habit I recommend. When you look at a food label, focus on sodium per serving, not just calories or fat. Many people check the wrong numbers. For blood pressure, sodium is often the more important detail. And if you are taking medication for blood pressure, this becomes even more relevant. Medication helps control pressure, but it does not remove the underlying load created by diet. If the daily intake remains high, the medication has to work harder. That can lead to adjustments, additional medications, or less stable control over time. This is something many patients do not realize. They assume the prescription alone will manage the problem, but the body is still responding to what it receives every day. So, the most effective approach combines both: medical treatment when needed, and reducing the constant dietary pressure on the system. At this stage, I want you to think about something simple. Which of these foods shows up most often in your routine? Not occasionally, not once in a while, but regularly. That is usually where the biggest improvement can be made. If you start there, even one adjustment can lower the daily burden on your body. And when that burden decreases, your blood vessels, your heart, and your kidneys all work under less strain. If you found this helpful and you want more clear, practical explanations like this, you can subscribe to the channel. It's designed to help you understand what matters before it becomes a bigger problem. And if you feel comfortable, tell me which of these foods you see most often in your routine. That kind of awareness is often the first step toward better control. The important thing to remember is this: blood pressure is not just a number you check. It reflects how your body is managing stress, fluid, and vessel function every day. And small, consistent changes often matter more than large, short-term efforts.